turns out Jackson is homozygous with MTHFR, and I'm heterozygous. So
Okay, explain that for people.
so he has double mutation, double G mutation, and he cannot methylate properly. We can't methylate properly, so we cannot get basically any heavy metals, any toxins, things like that that go into our body don't leave. So all of the vaccines and the allergy shots and everything that I had as a kid are all the metals and all the adjuvants and everything are still in my body. Jackson actually started out as a baby who was not vaccinated. I did not know what I was going to do. I hadn't even thought about it, but I was pregnant, and my midwife came to me and told me that I was going to be getting the RhoGAM shot. And
Did you say why?
because babies die if they don't, was her reasoning. She had no explanation. She had no literature. She said her aunt had lots of babies die because she didn't get the RhoGAM shot, so I need to get it. And I don't like being backed into a corner, so that was the start of my path. I said, I'm going to think about this, and I went home, and she said, well, you have to come back in 2 weeks and explain to me why you don't want to get this, but we're going to do it. And I'm like, we'll see. And I came back with lots and lots and lots and lots of research, and I decided I wasn't going to, not only was I not going to be receiving RhoGAM during my pregnancy, I probably wasn't going to be receiving it afterwards. And I had then stipulations about what was going to be happening at my birth, and that she was not going to be there, that one of the other midwives was going to be at my birth. So that was actually the beginning, just the start of my path.
I'm trying to get over that statement of you're going to have the RhoGAM because if you don't, babies will die.
I've spoken to so many moms that's why they get it. That their doctors are just like, they don't really have an explanation. There's parents that I know that don't vaccinate their children, but they're like, but I had to get RhoGAM because otherwise my babies were going to die. So I know parents that have injured children that it began with RhoGAM because it crosses the placenta. And there was one study, and it's no longer on the internet, big surprise, but there was one study that a doctor performed on her own patients that had autism, and over 60% of those patients came from a mother who was vaccinated with RhoGAM during the 28th week.
I really hope my sister's listening to this right now.
There's a book called Anti-D in Midwifery that is an amazing book. It's very expensive on Amazon, but you can get it. And there's websites. I'll get in touch with you and share it with you because I can't think of it right now.
But here's the problem with RhoGAM, okay? So you've got someone like my sister she's 30 years old, she's on a second child, and she gets everything that happened to Billy and everything, but all of the doctors are saying to her, your baby's likely to die if you don't. And I can't say to her, don't have it because if anything, God forbid anything happened to that child, then Polly's fault again. I mean, what do you do about this?
If she gets her titers tested and she doesn't have antibodies happening, basically RhoGAM is to technically prevent, this is what they say, is to prevent the blood from crossing, and that would happen during a trauma if you're pregnant. So this is something that can also be handled within 72 hours of a trauma. So if you're in a car accident, you fall down the stairs, something happens, you have 72 hours to actually get the RhoGAM shot. So you can make that decision at that point. I would be hard-pressed to still even make the decision, but knowing what I know. But there is that chance. I mean, you can still make that decision at that point. There's so much information, and I wish that I could think of the website off the top of my head. It's been 5 years since I've had to think about it, but there's a lot of information, and I'll make sure that I do share it somewhere. I'll send it to you and make sure that I give it to you for your sister at least.
Thank you.
I will.
But then I send my sister stuff, and I get family members saying, will you stop scaring her? You're scaring her, and that's bad for the baby.
The doctors are scaring her into doing it. So
I know, but that's how we're attacked. By the way, people are saying hi to you, but my eyes are so bad that I can't see exactly who that is.
Hi, whoever it is.
They clearly know you. So.
Well, thank you.
Yeah. Anyway, so do carry on.
So he started. So my choice not to vaccinate him was a choice in the beginning. I knew then, as soon as I started on that path, and I came back with all the information, and I knew more than the midwives, and they were like, "Well, we've never heard this, and we've never heard that." not really that shocked, but I was kind of surprised that they were so willing to push it on me, not knowing the information. So that was how our path started. And I really I wasn't an activist, I didn't get involved whatsoever. And then he turned 3 and he fell and had to get stitches. Where were the stitches
What
you got?
happened? How did you fall?
Right here? Were you running around?
My head was gushing blood.
Gushing blood.
You know, but that's how boys' childhoods should be.
Right. You were having fun though, huh?
You had fun, you fell over, and so what happened?
So he also had almost an open cut on his chin at the same time, loose teeth, everything, just a nightmare.
Oh, wow.
I mean,
Okay.
so I scooped him up and I went to the emergency room, terrified because, I have a child who's not vaccinated, and I was in the Chicago area. And the the nurse came in and she asked the question, is he up to date?
That, by the way, they're guessing ahead. They kind of know the ending of the story.
Mm-hmm. And
DTaP stuff going on.
So I toyed around with just saying, yeah, he's as up to date as he's ever going to be, and all the things that we think about what we would say. And I just said, no, he doesn't have any vaccinations. We have a religious exemption. And she decides at that point, while my son is bleeding, to start lecturing me about. She said, well, let me ask you why. And I said, well, I'm really not going to talk about this right now, and it's not going to change my mind. We're not going to have any vaccines today. And she said, well, we're not going to treat him without having DTaP. And I said, can you explain to me why he would need pertussis or diphtheria? I can understand your argument, even though I didn't, but I can understand where she'd be pulling tetanus out. But why would whooping cough be in the equation for stitches in your eyebrow? I don't understand. She just said that's what we do, and that's how it is, and there was really no conversation about it. We fought back and forth. I had my aunts were there, actually. They showed up because I was just panicking. They fought back and forth. Now, at that time, this was 2014, and I did not know that they stopped with a single-dose tetanus shot. I argued and said, I will do that. That is all I will do. I didn't know that stopped in 2012. Actually, Marcella was the one that told me that.
Marcella Pantone. Oh my gosh,
She
thank
did.
God for her.
Except she told me that later, after this happened. But basically, she fought and fought and fought with me, telling me, no, we're not going to do it. Now, this is a doctor, that when the doctor came in, she was a doctor from Lurie's Children's Hospital in Chicago, or Lurie's Hospital from Chicago. And she just happened to be working at this other hospital, and there was just a case of medical kidnapping at Lurie's. I had just read about it that week, and I saw her coat, and I just started having panicking feelings because they're telling me that they will not treat him, and all I'm thinking is they're going to call CPS, and I don't know what to do. I can't just up and leave with a child who has a gaping wound on his head. So I was still sitting there trying to make the decision. My aunt was saying, maybe you just need to think about it. And just then the pharmacist peeks his head in the door and says, we do have the single-dose tetanus shot. I didn't know he was lying, but he was. And I don't know. I mean, they just played me completely. And I was at the point, he's exhausted. And he was falling asleep from crying for so long. They had already cleaned it out and everything. So finally, I just said yes, and turns out that they gave him DTaP without my permission and without my consent. And at first, I didn't really notice anything. And I really didn't even put it together until later. But then I started noticing things like my super well-behaved child that everybody was always telling me was so well-behaved was not so well-behaved anymore. It was harder to get him happy when he would all of a sudden become very, very angry. A 3-year-old angry child, which was so strange. He would start to slam his hands over his ears when there were really loud noises. The window being rolled down in the car.
Oh my gosh.
It was just too loud all of a sudden, and then it was, somebody opening a can was the equivalent of a gunshot. Like that was, he would just slam his hands over. That was just not something that happened before.
We've all lived those symptoms.
And you know what was weird is that I didn't realize it until I was talking to Eric Layden at our trace amount screening that we had in Springfield. He asked me about my journey, and he started, he was surprised that I had made the decision I did before having any sort of information. I had no friends that did not vaccinate. We started talking about he was talking about the symptoms that I was describing with Jackson, and he was the one that started talking about it, and I said, that's exactly what's happening with him. And it just started like boom, 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 and it was like dominoes. It all came together, and I'm like, I think that he was injured by this vaccine. It didn't even come together until then, and it was maybe 8 months later. So we did genetic testing for a totally different reason. I found out that I have Ehlers-Danlos syndrome. My doctor told me.
You have what?
Ehlers-Danlos syndrome.
What's that?
It's a joint disorder, connective tissue disorder. So when doctors tell you you're bendy or have double joints, that's basically what I have. I'm very hypermobile. And he said that, and it's genetic. And he said maybe you should do a genetic testing. So we did. Turns out Jackson is homozygous with MTHFR, and I'm heterozygous. So
Okay, explain that to the people.
so he has a double mutation, double G mutation, and he cannot methylate properly. We can't methylate properly, so we cannot get basically any heavy metals, any toxins, things like that go into our body don't leave. So all of the vaccines and the allergy shots and everything that I had as a kid all the metals and all the adjuvants and everything are still in my body. I passed a lot of that down to him. I mean, he has a lot of the aluminum, and he has a lot of the things that just came directly from me, along with the DTaP, obviously. But you know, the glutathione and that would help to prevent, like the antioxidant, basically, that's the natural antioxidant in your body that would help to prevent damage. It depletes a lot faster, and you know, he's just susceptible. So now that I know that, I'm glad that I made the decision that started out as a personal choice, but now is a medical one. So that's kind of where we're at. Because of everything that we went through, some parents, I live in Illinois, and some parents and I, when the bills were passing all over the country, we started, fighting locally and talking to our legislators, and we do have a coalition that actually works with all the parents. Teresa, that you met earlier, is part of it as well, but we have a coalition of parents that work together, and
You're a friend of Lisa Joyce Gerrits.
I am. Mm-hmm.
We love her.
We love her too.
We've
We
been
do.
fighting long and hard for a long time.
Mm-hmm. She really has, and we love Noah and Jackson. Noah's your buddy, huh? Yep. Oh,
Okay.
shy.
That's okay. Come on.
So Illinois Coalition for Informed Consent is something that we started, so parents can just kind of have a voice to work together and learn how to talk to legislators and make changes locally, because we were not sure what was going to happen nationally, and we just need to keep on fighting.
So, talk to us about your son. We've just seen him. He's wonderful.
Mm-hmm.
So,
Yes.
what's the outcome of what happened to him?
So I'm working on, doing some detoxing, homeopathy, lots of detox baths, things like that.
Does he have a diagnosis of anything? No, you can tell.
This is where I'm feeling very fortunate. Had we kept going, he would have. I'm confident in that. Just seeing, how one vaccine caused him to change.
What's your message to the people of this world that are like we used to be?
I think what's most important is you need to just feel empowered enough to stand up to the bullies, whether they're the bully in the hospital.
But the doctors should not be the bullies.
Absolutely
we've
not.
taught all our lives to look up to them and take their advice, because we don't have medical degrees.
Right.
So you've got to question, going back to Dal, victory, question everything. I was not brought up
Absolutely.
to question everything.
No.
Most people are not.
No.
We'll go to school, learn, do as you're told, be quiet, children are, should not be heard, and all that kind of stuff. And that's what caused our injuries. So,
Absolutely.
So what's your message to let's say Bella's 21 years old, not had children yet. What's your message to her as if she was the average girl?
I think the message would be you have to advocate for yourself, because you have to know that you have the right to ask questions. You have to know that there are doctors that are not bullies. And if you're feeling bullied, just going back to like my midwife, I thought that I had the right choice in provider when I first started. And when I was bullied or backed into a corner by somebody that I was trusting was more on the natural side of things and more holistically inclined, I was backed into a corner and given nothing but fear-mongering advice. And I just trust your gut when you feel like you're being pressured into something. It's probably not a good idea because somebody wants to shut you up and just make you comply. And that was just what started me on my path. And know that if you don't agree with what everybody is saying about vaccines and autism and things like that, just start baby steps and just start listening and start reading a little bit, because I guarantee there's going to be something that resonates with you. And know that just because you're finding that things might be a little bit more dangerous than you knew, it's not that your parents didn't make the right decision, it's that they were not informed. And it's not that your doctor didn't make the right decision, he also was not informed. And I don't really think that people are capable of accepting what has happened to them and around them at this point, and that's why there's so much pushback. It's difficult for people to accept that they've been lied to, and that is the biggest bite they have to take, is they have to accept that before they're willing to learn.